Most people believe a heart attack comes with a warning, a crushing chest pain, a numb arm, a sudden collapse on the floor. But that's Hollywood fiction. After a certain age, the deadliest events are the silent ones. The ones that creep up in the dark while you're lying still, no alarms, no chance to fight back. And here is the truth that shocks my patients when they wake up in the recovery room. These silent attacks are almost always triggered by something ordinary, something you do every single night without thinking right before you turn out the light. I'm Dr. James Remington. For the last 2 decades, I've been a cardiothoracic surgeon. I've opened rib cages, repaired clogged vessels, and held the human heart in my palms while it restarted. But I've also spent 20 years watching the same preventable mistakes destroy people who had no idea at all, what they were doing to themselves between midnight and dawn. Who had no idea at all what they were doing to themselves between midnight and dawn. Tonight, I'm walking you through 5 specific patterns, 5 nightly habits that are quietly loading a weapon while you dream. And then, I'm going to show you exactly how to disarm that weapon with one simple evening routine. Stick with me. What you hear in the next few minutes might be the most critical health information you get all year. Here's a fact most people ignore. Your heart doesn't punch out a time clock. It never sleeps. But it does shift gears. Your heart works the night shift even when you don't. In a healthy body, nighttime is when your blood pressure is supposed to dip, usually 10 to 20% lower than your daytime numbers. Your pulse slows. Your arteries relax. It's a biological reset, a nightly tune-up your body has been running since birth. But after 60, that system starts to glitch. Your blood vessels stiffen. The pressure regulation gets sloppy. The protective hormones that used to guard your heart at night begin to fade. And the room for error, it shrinks to almost nothing. Think of it like this. During the day, your cardiovascular system has backups. It can adapt, compensate, push through. At night, most of those backups are offline. The body is running on a skeleton crew. That's why the hours between midnight and 6 in the morning carry the highest risk for a stroke or attack if you're over 60. It's not the afternoon rush hour, it's the quiet hours, the hours nobody is watching. Now here's the part that changes everything. What happens during those dangerous hours is almost entirely dictated by what you did before bed. The meal you ate, the pill you took or forgot, the temperature in your room, decisions that feel totally routine. Let's start with the one that shocks my patients the most. What time did you sit down for dinner last night and what was on your fork? I ask this in every single pre-op consultation. And for a shocking number of people over 60, the answer is 8, 9, sometimes 10 o'clock at night. A heavy plate, pasta, bread, red meat, something fried, then the couch, then bed within an hour. I get why. Life is busy, family schedules are chaos, it's a lifetime of habits. But from a cardiac perspective, this is like asking your heart to sprint a marathon right before bed. Here's the physiology. When you eat a massive meal, your digestive system demands a massive increase in blood flow. Your heart has to pump harder, your blood pressure spikes. Triglycerides, the fats in your blood, surge within 2 to 4 hours. Now put that on top of sleep. Your body expects the evening to be a cool down. Instead, it's a cardiovascular emergency. Your heart is working overtime to digest a feast while simultaneously trying to shift into low gear. Those 2 jobs are in direct war. And if you're over 60 with any arterial stiffness, that war has real consequences. Studies prove that eating within 2 hours of sleep is linked to higher nighttime blood pressure and increased cardiac events during rest. The fix isn't complicated. Finish the feast before sunset to let your heart rest. Eat your main meal by 6 or 7. If you must eat late, keep it light, protein and veggies, not grease and sugar. Does your dinner schedule look like that? Most people say yes, and they never connect it to their heart. Now this next one, I need you to listen very closely. This is where the most preventable damage happens. If you are over 60 and you take medication for high blood pressure, statistically over 60% of you do, the timing of that pill matters more than most doctors have time to explain. Most people assume blood pressure is steady. It's not. It curves up in the morning, peak in the afternoon, dip at night. But a huge chunk of people over 60, especially those with hypertension, don't get that dip. Their pressure stays high, or it actually surges in the early morning hours. It's called nocturnal hypertension. Most people have never heard of it. And it is dangerous in a way daytime high blood pressure is not. While you sleep, your arterial walls aren't braced for impact. A pressure surge at 3 a.m. hits those walls differently than one at 3 p.m. It's more likely to rupture a soft plaque, more likely to form a clot, more likely to put you on my operating table. If you take your meds only in the morning, they may have worn off by the time you need them most, the vulnerable hours of the night. If you forget them entirely, you're sleeping naked in a storm. What do? Talk to your doctor. Specifically about timing, ask, should I take this at night instead of the morning? The conversation takes 2 minutes. It could save your life. The HYJAK chronotherapy trial proved that evening dosing significantly reduces cardiovascular risk during sleep. Do not assume timing is trivial. In cardiology, timing is often the entire difference, and most patients over 60 have never had this conversation. I want you to think about someone you know who snores, a spouse, a parent, maybe yourself, that rattling, gasping sound in the dark. Most people treat it as a joke, something to laugh about. I treat it as a cardiac siren until proven otherwise. After 20 years in this field, I mean that literally. Sleep apnea is one of the most underdiagnosed killers in people over 60. Roughly 30% of older adults have it. Most have never been tested. They have no idea what it is doing to their heart every single night. Here's what happens during an apnea episode. You stop breathing for 10, 20, sometimes 40 seconds, dozens of times an hour. Each time your oxygen level crashes, your brain panics and fires off a stress bomb, adrenaline, cortisol, a sudden spike in heart rate and pressure. Your heart jolts awake while the rest of you stays asleep. Now imagine that happening 30 times a night. What that does to the body is not subtle. Sleep apnea is linked to a 3 times higher risk of heart attack. It is tied directly to irregular rhythms like atrial fibrillation, which itself skyrockets stroke risk. It accelerates the stiffening of your arteries. The warning signs, loud snoring, yes, but also waking up with a headache, feeling exhausted after 8 hours, running to the bathroom all night, dry mouth, a choking feeling. If any of that sounds familiar, see your doctor. Ask for a sleep study. Here is my blunt advice. If you snore loudly, you're over 60, and you have any history of heart issues, getting evaluated for apnea is not optional. It is part of your cardiac care, full stop. The treatment, usually a CPAP machine, isn't glamorous, I know, but the data is stunning. Patients who use CPAP show real drops in blood pressure, lower rates of AFib, and significantly reduced risk. Does anyone in your house snore? Have you been told you stop breathing? Think hard before you move on. This next habit is driven by logic, which is exactly why it's so dangerous. Many people over 60 intentionally limit water in the evening. Why? They don't want to wake up at 2 a.m. to use the bathroom. Disrupted sleep is annoying. Getting up increases fall risk, so they cut fluids after dinner, sometimes after 4 p.m. I understand the logic completely. But from a heart standpoint, going to bed even mildly dehydrated is a serious risk factor, and almost nobody talks about it. Here's why. When you're dehydrated, your blood gets thicker, viscous. It doesn't flow freely. For a young heart, that's a minor inconvenience. For a person over 60 with stiff arteries and plaque, it's a disaster. Thick blood moves slowly through narrowed pipes. It is more prone to clotting. And here's the timing problem. During sleep, your heart rate naturally slows. Blood moves slowly anyway. Combine slow circulation with thick blood in a body lying still for 7 hours with narrowed arteries. That's the recipe for a morning stroke or attack. The fix is laughably simple. Drink 1 glass of water before bed, 8 ounces. That's it. Enough to keep your blood from turning to sludge. Keep another glass on the nightstand for when you wake up thirsty at 3 a.m. That thirst, that's your body begging for something your heart also needs. You don't have to choose between sleep and survival. Here's one that surprises everyone because it sounds too simple. What temperature is your bedroom right now? Most people never think about it for heart health, but your cardiovascular system has a preferred range. Outside of that range, your heart works harder for no reason. If your room is too warm, above 72 degrees Fahrenheit, 22 degrees Celsius, your body tries to dump heat. Your vessels dilate. Your heart rate stays elevated. You sweat, losing fluids, hello dehydration again, and your sleep quality tanks. You lose the deep restorative stages where the heart recovers. If your room is too cold, below 65 degrees Fahrenheit, 18 degrees Celsius, you get vasoconstriction. Your vessels clamp down to preserve heat. Blood pressure rises. The heart pushes against a closed fist. For someone with coronary disease, that nighttime pressure spike is dangerous. The sweet spot? Between 65 and 72 degrees Fahrenheit. That zone keeps your vessels relaxed, your heart rate low, and your sleep deep. One simple setting, real protection. Everything I've said might sound like a long list of worries. I want to flip that. When you look at all 5 habits together, what you actually have is a blueprint, a simple, practical evening routine. I call it the heart-safe nightly protocol. Here's how it looks. Between 6 and 7 p.m., main meal, lean protein, vegetables, a reasonable portion of carbs. Not a feast, not a fast, just a proper dinner at a proper hour. This gives your heart 3 to 4 hours to settle before sleep. At 7 p.m., water and medications. If you haven't asked your doctor about nighttime dosing for blood pressure meds, put a sticky note on the fridge right now. Between 8 and 9 p.m., wind down window. A gentle walk, reading, a calm conversation. No bright phone screens, they kill melatonin and keep your nervous system alert. By 9 p.m., prep the room. Adjust the thermostat to 68 degrees. Set a glass of water on the nightstand. 90 seconds of effort. By 10 p.m., lights out. And one final detail that costs nothing. If you snore, sleep on your side, not your back. Back sleeping worsens airway collapse dramatically. A simple position change can cut apnea events in half while you wait for a sleep study. Dinner by 7, water and pills, calm evening, room prepped, bed by 10, side sleeping. The question is never whether this works. The data is clear that it does. The question is whether you will actually do it. And that's a question only you can answer. I want to be honest with you now, not as a YouTuber, as a surgeon. I have stood at an operating table at 3 in the morning, holding a heart that stopped because of a clot that formed overnight. I have sat with families at dawn who had no idea anything was wrong when they said goodnight just hours earlier. I have read reports on people who were planning birthday parties the week before, and in case after case, the factors were not mysteries. They were a late dinner, a skipped pill, a bedroom that was too warm, a body running out of water, an airway collapsing silently for years, while everyone assumed the snoring was just snoring. These are not exotic risks. They are the background noise of millions of ordinary evenings. And that noise, accumulated night after night, becomes a cardiac event that nobody saw coming because nobody knew to look. Here is the truth that 20 years in the operating room gave me. Most of the hearts I repaired didn't fail because of bad luck. They failed because of bad information. Information the patient simply never had. You have it now. The only question is what you do with it. Tonight, not next week. Tonight, let's bring it home. 5 habits, 5 fixes. 1. Finish your main meal by 6 or 7 p.m. 2. Ask your doctor about taking blood pressure meds at night. 3. Get evaluated for sleep apnea if you snore or wake up tired. 4. Drink a glass of water before bed. 5. Set your bedroom to 65 to 72 degrees Fahrenheit. Now, I'm going to ask you something direct. I genuinely want you to answer in the comments, which of these 5 habits do you recognize in yourself? I bet at least 2 hit close to home. You're not alone. Most of my patients recognize themselves here. The difference is you now know what to do. If this video gave you something useful, share it. There is someone in your life, a spouse, a sibling, a friend over 60 who has never connected their nightly habits to their heart. Send them this. One good night might save your life. The habits you ignore become the history you regret. Take care of that heart. It has been working for you every single minute of every single night for your entire life. Give it the conditions it needs to keep going. One last thing, everything here is general medical information based on current research and my clinical experience. It is not a substitute for your personal doctor. Before you change any medication schedule, please talk to your own physician. That's not a legal disclaimer. That's genuine advice from someone who wants you watching this channel 10 years from now. Good night, sleep well, start tonight.